Now, in the fourth and final section of our lecture, we will talk about the different procedures we can use to remove the foreign body that is lodged in the airway. So the management or the treatment or the steps we can do or techniques we can use for the removal of the foreign body depends on the site of the lodgement of the foreign body. So it can be laryngeal foreign body. Then we will talk about how we can remove if it is in the larynx. Then trachea and bronchi foreign body. And then what are the different equipments used for the removal of the foreign body. So management of the foreign body. First, let's talk about the foreign body that is lodged in the larynx or laryngeal foreign body. Large bolus of food, sometimes a large bolus of food that is ingested can get stuck in the larynx and cause really bad choking and gagging. So the large food bolus in the larynx is one foreign body. Obstructed above the vocal cords. Patient totally aphonic. No sound is produced because they can just point towards the throat that something is going on, but they have no voice at all because it is present in the larynx. Then unable to cry for help. They cannot cry for help and they have no voice. May die of asphyxia. As I mentioned before, complete obstruction of the larynx can cause sudden death because of asphyxia, because of decreased supply of oxygen, decreased absence of breathing. It can cause sudden death. Or immediate first aid measures needs to be taken. So immediate first aid measures needs to be taken to prevent that sudden death from asphyxia, especially in case of complete obstruction of the larynx. If it's partial obstruction, then there is some air going inside and it cannot be as serious as with the complete obstruction. Laryngeal foreign body, the measures we can take to remove the foreign body is pounding on the back. Very first initial step, ask the patient to lean a little and then do the pounding on the back. That helps the foreign body sometimes to go up and get dislodged and coughed out or spit out. Then the turning patient upside down also, especially in small children, infants, if there is something, put them upside down and slap on the back. That really helps to bring the foreign body out. Heimlich maneuver is part of BLS, basic life support, and then it should be performed. Later on I will talk about what this Heimlich maneuver is. And then not done if patient is partially obstructed. Does not need to be done because if in case of partial obstruction there is breathing, there is less likelihood of death from asphyxia. So all these emergency maneuvers usually need to be done in case of complete obstruction. Then the Heimlich maneuver is stand behind the person who have foreign body present. Always stand behind the foreign body, person and put the two arms around the abdomen, in the upper part of the abdomen like this, and then place arm around the patient's lower chest. Give 4 abdominal thrusts. Give 4 abdominal thrusts. With this finger usually like this, give 4 abdominal quick thrusts. Residual air in lungs, which is present once it's expelled out, it may sometime dislodge the obstructed foreign body that is causing obstruction that comes out. So lower abdominal thrust Hamlet maneuver, providing some airway. Then the cricothyrotomy or emergency tracheostomy can be done. This is done when Hamlet maneuver fails to bring out the foreign body. Once acute respiratory emergency is over, we can try this procedure. Foreign body can be removed by cricothyrotomy or emergency tracheostomy. By direct laryngoscopy, by laryngeal fissure if it's impacted. So once the emergency is over, then we can do the cricothyrotomy or emergency tracheostomy to remove the foreign body that is lodged or impacted. Tracheal and bronchial foreign bodies. We talked about the laryngeal. If it's complete emergency, afterwards the emergency tracheostomy. If it's partial obstruction, not complete, we don't need the emergency maneuvers. Then the tracheal and bronchial foreign bodies, they are removed by bronchoscopy with full preparation under general anesthesia. Emergency removal is not indicated unless airway obstruction, nor foreign body is of vegetable nature like seed and which swells up and which can cause congestion and serious obstruction. So tracheal and bronchial foreign bodies, they are removed by bronchoscopy under general anesthesia. Bronchoscopy is performed, and in these conditions emergency removal is not indicated unless there is airway obstruction, severe airway obstruction, or if there is foreign body that can swell. Removal of tracheobronchial foreign body is, we can also try conventional rigid bronchoscopy. Rigid bronchoscopy with telescopic aid. Bronchoscopy with C-arm fluoroscopy and use of Dormia basket. Here the use of Dormia basket that grabs the foreign body, or Fogarty's balloon for rounded objects. So these are different techniques which are tried for the removal of the tracheobronchial foreign body. Tracheostomy first and then bronchoscopy through the tracheostome can also be done. Thoracotomy and bronchotomy for peripheral foreign bodies, and flexible fiber optic bronchoscopy in selected adult patients. So these are again the techniques. We can even do tracheostomy, and then through that tracheostome bronchoscopy can be performed and foreign body can be removed. Thoracotomy, sometimes the foreign bodies cannot be removed until complete opening of the thoracic cavity can be done, which is the thoracotomy. Here you can see the complete chest cavity is opened by the cutting of the ribs intercostal spaces, and then the foreign body is removed, especially the peripheral foreign bodies. Flexible fiber optic bronchoscopy in selected patient, and we can use the old rigid bronchoscopy method also. Equipment for the removal of foreign body, we have a bronchoscope appropriate for age of patient. Bronchoscope can be used, then we can use size smaller and other a size larger. Telescope or optical forceps, these are the optical forceps used to grab the object. Two laryngoscopes, we can use the laryngoscopes, foreign body forceps, Domia basket, and then Fogarty's catheter and syringe to inflame it. So all these are different equipment that can be used for the removal of the foreign body. That conclude our lecture, which was the airway obstruction. We talked about the obstruction by the foreign body and different types of foreign body, what's the mechanism, how they can cause obstruction, how we can diagnose the foreign object, and how we can manage the foreign object. So thank you for watching sqadia.com.